Alex Earl. We're here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. As many of you know, it's the time I get to spend with you guys and answer a whole bunch of questions and, of course, go over plastic surgery topics. Today, of course, we're on IG, as we usually are, but it looks like I think we're also on YouTube here today for our first YouTube Live. So we're trying a few things. Last week, I think we did our first TikTok Live. Today, we're on YouTube as well. You can always find me on IG. All right. So, what are we going to talk about today? Well, we're going to talk about the new rules here in Florida, specifically for gluteal fat transfer procedures. Of course, in layman terms, this is the BBL. So we got some new rules. Last week we talked about it a little bit. They had voted on it, but it hadn't been ratified. It was kind of a bumpy week after that. We weren't sure, were they going to do it, were they not? Even up through kind of early yesterday, it hadn't been ratified yet. And then it seemed like towards the end of the day that they were going to follow through. And so as far as we know, as of right now, these are the new rules in Florida. It is what's called a 90-day emergency rule, okay, which means that they can basically implement it immediately, and then it will go for 90 days, at which point they will then make a decision whether to, make it something more permanent or to remove it, okay? So that's their status here in Florida, like I said, it was a little touch and go there, but it appears that these are now going to be finalized. The one caveat that I do want to say, though, is that it's not officially on their website yet. Not officially on the website yet. So could it be that all of a sudden there's a change of heart? I think the possibility is small, but it does exist. Okay. But what are these new rules? So the whole document's about 9 pages, but basically you can kind of synthesize it into 2 new rules and one where they just kind of edited the old rule that had been standing, okay? So the first rule here in Florida is that fat may only be injected into the subcutaneous plane, okay? So that's the first rule. Fat can only be injected into the subcutaneous plane. What is the subcutaneous plane, you may ask? So that is the plane that's between the muscle and the skin. Okay, so if you were to draw things like on the side view, you got your skin, okay, and then you're going to have this layer which is called the fascia, and then underneath that is going to be the muscle, okay? And so you want to be injecting fat into this layer, which is what we call the subcutaneous layer there, okay? So that is actually the only safe place to inject the fat, because if you penetrate that fascia and you go into or deep to the muscle, that's where you're going to have your large vessels. They're called the superior and inferior gluteal vessels. And if you injure one of those and fat gets in, then that becomes a fat embolus. And that embolus can then travel to the lungs. Essentially, you can think of it as clogging up the lungs, and then the patient can die. Okay? So that's why it's very, very important to only place the fat in the subcutaneous plane, okay? Now the second rule now is that all surgeons here in Florida, and that's the entire state of Florida, okay? All surgeons in Florida must use the ultrasound imaging for guidance when placing the fat to make sure that you're in the subcutaneous plane, okay? So now they're trying to, turn it from a blind procedure where you can see where that cannula is. Okay, so all surgeons now are mandated to use the ultrasound during this portion of the procedure. Okay, and then the third rule is that any particular surgeon, you can only do 3 BBLs in a day, right? No more than 3 BBLs in one day. So 3 is going to be the max. All right, and that's per the official quote says per calendar day. Okay, so 3 BBLs max per calendar day. So as of right now, it appears that these rules are in effect. And like I said, it's not officially on the website. I would assume it's going to be on there soon. And then we're going to have to follow these rules at the very least for the next 90 days. All right, and this pertains, of course, to every single surgeon in Florida because these are the rules for MDs and DOs. Okay, so for the Board of Medicine and the Board of Osteopathic Medicine as well. Okay, so you know, there's some controversy out there. Some surgeons agree with this, some don't. You know, from our point of view, what I can tell you is, of course, we follow all the rules by the Florida Department of Health. And what I can tell you is that from our point of view, this doesn't really affect us much because we've been doing this for years. Okay, in terms of injecting only the subcutaneous space, I've certainly been doing that for over 4 years now, actually pretty much from the beginning, okay? So I would tell you that way back, 2017 or before then, there was a lot more surgeons injecting into or deep to the fat, deep to the muscle, because at that point in time, it was felt that you could get better results and you could get better fat retention, and you could get more drastic results as well because you essentially had 3 spaces to fill. You could fill the subcutaneous space, you could fill the muscle, and then the deep space deep to the muscle. And so you can get these like really drastic results with just one surgery, and you could put in over close to 2,000 cc's of fat per side. Okay, and then of course we learned back in 2017 that it was really dangerous to do that, and the mortality rate of the BBL was way too high, approximately 1 in 3,000. So then we started with these first rules where fat could only be injected in the subcutaneous plane. That helped things a lot. By 2019, the mortality rate had gone down to 1 in about 14,000, which is pretty much equivalent to your run-of-the-mill tummy tuck. Okay. The problem was that since 2019 up until today, unfortunately, were still too many deaths here in Florida. Okay, so that's why the Department of Health then basically decided that they had to do something else, something additional, which is when they implemented these 2 rules. But for me, I started doing ultrasound guided BBL in September of 2019. So we've been doing it here at Pure for about 3 years now. Not only that, but I've done the most ultrasound guided BBLs probably in the entire nation. I've done close to 2,000 ultrasound guided BBLs. Okay, so huge experience there. And of course, I've had a 0 fat embolus, 0 mortality rate from that. Okay, so we've been doing this for years. Dr. Verdal came and joined us in August of last year. Of course, first thing I did was train her on how to do the ultrasound guided BBLs. And she's doing awesome with it now. Of course, she does that on her own, and because now she has done herself over 200 ultrasound guided BBLs. So she's pretty much an expert at this already. All right, so we've been doing this at Pure for a long time. Again, it's a way in which you can now turn a blind procedure into one where you can see exactly where that cannula is when you're over that danger zone. You can make sure you're putting that fat in the correct and safe space. Okay, it's also, I believe, a great tool for training new surgeons, right? So I'll ask you guys a question here and see if I get a few responses. Okay, let's see if we get a few responses. How many BBLs do you think that I did during my plastic surgery training at Duke when I was a resident? Let's see if we get a few responses there. Anyone?
Yeah.
No?
Yeah.
Okay. All right. Well, none. 0. Okay. All right. And then how many BBLs? Now, of course, I graduated quite a few years ago. That was back in 2012. Now, how many BBLs do you think residents nowadays are doing at their training programs?
300, 500, 20.
Way off. Yeah.
Then 10.
So Dr. Riddell, when she had graduated, she had done, I believe it was like less than 5, right? At that point in time. So and then the other residents today, they're doing they're not doing very much in the program. So you graduate your residency program, right? And then there's this huge demand for this procedure, and you want to start doing it. But how do you start? How do you train, right? Well, the best thing to go is to go to a guy like me and and we can train them to do it, but not just to do it, but to do it safely. And so one of the greatest tools to do that is with the ultrasound, because now I can see what they're doing, right? Before, without the ultrasound, you're trying to train someone to do a BBL, it can be very scary. You don't know where they're at. You try to feel things, but you don't know, you don't know exactly where that cannula is. So now I can see exactly where they put the cannula. I can teach them where to go. I teach them how to use the ultrasound. And so then this becomes a procedure that's going to be much, much safer as we move along. So that's a big announcement here. Pure is going to become one of, if not the leading ultrasound-guided BBL training centers in the U.S. And we're going to be the primary ultrasound-guided BBL training center for the World Association of Gluteal Surgeons. Okay, that's WAGS. WAGS, World Association of Gluteal Surgeons. Okay, who is WAGS? WAGS Association is probably one of the most experienced gluteal surgeons, which is mostly BBL, fat transfer surgeons, not only in the US, but throughout the world. So this includes Canada, Central South America, Europe, etc. Okay? I'm actually the president of this organization. So I'm the president of WAGS, the World Association of Gluteal Surgeons, okay? And our number one priority, okay, beyond anything else, is patient safety. Okay, that is our number one priority. So we have very specific guidelines that all of our members adhere to, and our guidelines were in place much before all of these rules. Okay, and of course, their number one guideline was to place the fat in the subcutaneous space. Okay.
Congratulations, many.
All right, awesome. Well, thank you. But yes, it's an awesome organization. Some of the best BBL surgeons in the world, not just the U.S., but all over. And because our number one priority is patient safety, some of the safest BBL surgeons throughout the world. So if you're researching a surgeon, okay, and of course I would love for everyone to come here to Pure, but that's obviously not feasible. But if you're researching a surgeon anywhere, you can see if they're a part of WAGS, okay. You can look up, I believe it's www.gluteosurgeons.org. Okay, and if they're a member of WAGS, okay, that's essentially a seal of safety. That means that surgeon goes the extra step, they go the extra mile to make sure that they're putting the fat in the right place, that their track record is clean, that they have the adequate, training and everything to make sure that our patients are safe. Okay, and now we're going to be introducing, as part of the guidelines to WAGS, also the use of the ultrasound. Okay, so in order to do that, a lot of people need to learn how to use it. Okay, and who better to go to than to someone who's done about 2,000 of these already, right? So we're creating that training center. There's going to be a bunch of surgeons coming here, and we're going to train them up on how to use that ultrasound to make sure that they're in that safe space. Okay.
So many ask for the website, the WAGS website.
Yes, so it's going to be www.gluteosurgeons.org, okay? Or if you go to Google and you just Google World Association of Gluteal Surgeons, it'll pop up right there as well, okay? So it's a great website, a great tool to use, a great way to look up surgeons, in Mexico, Colombia, Dominican Republic, United States, Canada, Europe, some of the islands, we have Jamaica as well. It's a good place to start in terms of searching a surgeon that is going to have safety as the number one priority. And then of course, I'm not saying that you have to stop your research there. Please don't. You have to keep going, because it's only one piece of the equation. I mean, I know a lot of you guys have seen some of my talks where I talk about how to choose your surgeon, right? It's never just one thing, right? There's multiple things that you should look into. You should look into their education, right? Their experience, their board certification. Are they, board certified by the American Board of Plastic Surgery? You should look into whether they're a member of WAGS, okay? Then, of course, you want to look into their results, and you want to look into their before and afters. Is their style similar to what you're looking for? So there's many factors that play into this. And it's not just one thing that you should do when you research a surgeon to do your procedure. Okay. And then, of course, they have the rule here about no more than 3 BBLs in a day. That's the one that may or may not be a little bit more controversial. The problem is that you can't go overboard, right? We've heard of surgeons doing, 10 plus BBLs in a day, and that's just too much. Like every surgeon needs to know their limitations, right? So for me, I know like my limit is 5 surgeries in a day. Not all BBLs, because you all know I do more than that, right? I do anything pretty much from the neck down. So we do breast surgery, so that includes lifts, augmentations, breast reduction. We of course do tummy tuck, mommy makeovers, arm lifts, and everything else. But I know that 5 surgeries is going to be as much as I can do in a day. Within those 5, could 3 of them be BBLs? Then yeah, 3 of them could be BBLs, and then say like a breast dog and a tummy tuck, right? That could be a regular day for me. Or, it could be 2 BBLs and, 3 other surgeries, whatever it is, okay? But those are my limitations. Those are actually Dr. Vidal's limitations as well. So here at Pure, no surgeon is going to be doing more than 5 surgeries in a day, okay? And within those 5, no more are going to be BBLs, okay?
I don't know if you want to start with the questions.
Yeah,
this is on fire.
I've been talking too much, right? All right, let's go. Let's answer some questions.
Okay, first enough. Are you able to do a BBL and breast augmentation at the same time?
Yeah, so that's a good question, and we get it quite often. So these are, when I talk about the rules here, I've only kind of briefly talked about the gluteal fat transfer rules, but there are several other rules here in Florida. And one of them is that when you're doing you're adding a surgery such as a breast augmentation or a tummy tuck, then the amount of fat that you can remove via liposuction gets limited to only 1 liter or 1,000 cc's, all right? And for most patients, that's not a lot. It's not enough to create that beautiful Earl curve or change their shape, and certainly not enough to give them the volume and projection to the buttock and hips that they need. So typically, I don't like to combine those procedures, all right? You're not gonna get the results from the BBL that you want. The other thing, though, it also makes recovery, quite difficult because, of course, for your breast, you have to be on your back, and for BBL, you have to be on your belly. So, you can't really kind of just hang from the roof there, right? So it becomes more difficult in the sense that you have to, create these like special chairs and things like that with cutouts to try to relieve the pressure from the buttock and the hips.
Okay, will you explain the difference between a cosmetic surgeon and a plastic surgeon, please? Cosmetic versus plastic? So
there's quite a bit of difference in their training, basically, okay? So in order to be what I'm talking about here is in order to be board certified by the American Board of Plastic Surgery, you have to do a plastic surgery residency, right? So you basically have to be formed and trained and educated as a plastic surgeon, okay? And then, after you do that, then you have to do, about 50 cases, all right? And you have to take a written exam and an oral exam. And once you've got all that and you've passed all that, then you become board certified by the American Board of Plastic Surgery, and you're okay. Now, for a cosmetic surgeon, in order to be board certified by the American Board of Cosmetic Surgery, you don't necessarily have to start off as a plastic surgeon, right? You could actually not necessarily even really start off as a general surgeon. You can be an ENT, OB-GYN, general surgeon, etc. And you don't do any like formal plastic surgery training. From there, then you do what they call a cosmetic surgery fellowship, okay? And then once you pass that fellowship, then I understand you can get your board certification by the American Board of Cosmetic Surgery. The American Board of Cosmetic Surgery is not one of the recognized boards by what we call the ABMS. So that's the American Board of Medical Specialties. It's like the big umbrella. So the big umbrella has certain boards which they believe are, I guess they would call them official, okay? And so, of course, the American Board of Plastic Surgery is under that umbrella. It is considered an official board, if you will. And the American Board of Cosmetic Surgery does not fall under that umbrella, so not considered official by the ABMS.
Okay, this is Carla, and she says, I'm 4 week post-O. Can I sleep on my bed when I reach 6 weeks?
So after 6 weeks, yes. So I tell all my patients that you want to do your very, very best to relieve any pressure to the buttock or hips, okay, for the first 6 weeks, all right? And why is that? Again, it actually comes back to this. So because now we're placing that fat only in that subcutaneous space, we have to try to preserve or get as many of those fat cells to live as possible, okay? And pressure can affect this. So if you relieve the pressure on that backside for the first 6 weeks, which will get as many fat cells to survive as possible, but having said that, it will never be 100%. I want to make that very, very clear, okay? Our average fat loss here at Pure is about 30%. If you take all the studies, you know, it's for, if you take like a large number of surgeons, all the studies, you put all that together, average fat loss is somewhere between 30 and 50%.
Okay. What should be first, a tummy tuck or a BBL?
Great question. So we get this question all the time, almost on a daily basis, all right? And, you know, because a lot of people feel like they just want to get their BBL done, or they don't want to deal with the scar from the tummy tuck. But quite honestly, if you have you know, a significant amount of loose skin, so that we call that skin laxity, or a significant amount of weakness to your abdominal wall, the muscles of the belly, okay? If they're weak or they're separated, it is a much, much better idea to get your tummy tuck first. And I pretty much almost always recommend doing the tummy tuck first. So get your tummy tuck first, fix that abdominal wall so you can be flat, okay? Remove all that excess skin so that when you come back and do your BBL, everything can be smooth and nice and flat, okay? Because if you do it the other way around, then now you're creating scar tissue, right? You're creating scar tissue. If you don't fix the abdominal wall, you're still gonna have that pudging belly. It's not gonna be flat, okay? Because the wall is weak. The skin is not gonna retract well, so it's not gonna be smooth. It's all gonna be lumpy, wavy. People wanna blame this on uneven lipo. It's not uneven lipo. The problem is loose skin. And when loose skin doesn't retract well, it doesn't retract evenly. And it looks lumpy, bumpy. And the chances of fibrosis and scar tissue are higher. So now you're trying to do a tummy tuck, okay, because the patient's not happy. So now you're gonna do your tummy tuck, and you come back to this skin, which is full of, you know, scar tissue and fibrosis and stuff. It gets very, very difficult to pull down. You can typically remove less skin. And sometimes some of the scarring still leaves some areas of unevenness.
This question is about the fat removal limit when combining a BBL with a 360 lipo.
Okay, so BBL includes typically the 360 lipo. So that, in that sense, then when you're doing, you know, BBL, lipo 360, essentially nothing that where you're making these big incisions. Then you can remove here in Florida, you can remove 4 liters or 4,000 cc's. That's our limit here for office-based surgery.
Okay, doc. So, are you affiliated to any hospital? And if you can explain the importance of having hospital affiliations.
Of course, you definitely need to do that. And actually, in order to have what's called office-based surgery, which we have here at Pure and most of the places here in Miami or South Florida, you have to have hospital privileges, okay? And so I have hospital privileges in 3 nearby hospitals. One is called Baptist, one is called South Miami, and the last one is called Kendall Regional Medical Center. All big, great hospitals, and all within 10 minutes of Pure.
Okay, I read this 3 times from different people, so this is an important question for the women.
All right.
This says, do you operate if a patient ends up getting their period before surgery? Is it too much loss of blood?
No, typically we're okay with that, okay? So of course we always check your hemoglobin levels, you know, before you come in. We like them to be 12 or above. For certain procedures, we'll accept up to 11, okay? And if you are in your period, you know, it happens to be in your period on that day, it's okay. We still go ahead and move forward. Remember, for all the big lipo cases and BBL cases, we do use a cell saver, so that's going to help minimize the blood loss, all right? It doesn't eliminate any blood loss, but it does help minimize it. For example, say you started with a hemoglobin of 12, and then for whatever reason, you drop that hemoglobin to 8, but we can capture a lot of that, pass it through the cell saver, give it back to you, and that could probably then raise you back up to about 10. You won't get back up to 12 again, but you'll get back up to 10. You'll be in much, much better standing.
Okay, lovely says, is lipo included in a tummy tuck? And this.
So, so for a tummy tuck, lipo to the flanks and waist is included, okay? But like I said, it's limited. So we're only limited to those 1,000 cc's. For most patients, that's what you have in your flanks and your waist. And that's the area where we like to do it because we like to, contour the body with your tummy tuck to create, a nicer curve to the area. Sometimes we can add some small areas of liposuction to the tummy tuck. For example, say chin lipo. But that would be additional. That would be an additional cost, not included with the tummy tuck.
Okay, this one says, can you discuss BBL blowouts and blowout deformities?
Yes. Good question. It's been a while since we talked about that, and I could probably do an entire live on that. But so a lot of times, right? If you're looking kind of at the buttock on the side view, sometimes you have attachments, right? Attachments that attach that skin to the muscle underneath, and then that from the outside looks like a dent or a divot. What are these attachments? Sometimes it could be scar tissue, like say for example, you had a vaccine that was placed there as a kid. Sometimes it can just be cellulite, right? That's what cellulite is. It's attachments that pull the skin in, and that's why you have those divots, okay? Now, if a surgeon is over aggressive in removing those attachments with the cannula or any sort of instrument, if you're over aggressive and you destroy you destroy all the attachments, then you're gonna go from a dent to a blowout. Okay? To a blowout, and it's basically like you have a golf, depending on the size, a golf ball or a softball sticking out, and that's not good. All right, it's much harder to hide a blowout in clothing than it is to hide like a small divot or a dent. Okay, and then if on top of that you place fat in there, then you've created a pool of fat which either gets infected or it becomes a cyst. Okay, but a pool of fat can't get blood supply, or it becomes fat necrosis. So it's not good. It's either infected, a cyst, what we call a fatty cyst, or fat necrosis. Not good. So you want to prevent blowouts at all costs. You don't want to be overly aggressive. It's better to just partially fix the dent, like make it better, and not cause a blowout than to be overly aggressive and then create this problem, which is a very challenging problem to fix. Because once you do that, then you have to remove that cyst or that fat necrosis, okay? And then you're probably gonna end up with a dent again anyways after going through 2 or 3 more surgeries. All right, so the surgeon should do his very, very best, his or her very, very best to not create a blowout.
Yeah, we have a lot of questions, but I think we're running out of time. But
all right.
Can we go with a few more?
Let's do 5 more.
Of course. So those ab etching limit the amount of cc's that can be used for a BBL?
So ab etching doesn't change that. So when you're doing ab etching, again, we're still working with cannulas. We're still working very tiny liposuction incisions. So when you do ab etching, you still have the same 4,000 cc limit. It doesn't get lower.
Okay. So do you lipo upper back with lipo 360 like the buffalo hump?
So not the buffalo hump. So we could go pretty far up in the back. So I'm gonna do like a very crude drawing here. Okay. So when we do our regular lipo 360, right? This is the back. We go pretty high up. We go all the way up to here. So from about here down. So pretty much I would say about almost 90% of the entire back. Okay? And we certainly go all along that bra line. All right? But the buffalo hump, which is up here, okay, that we can do, but it is considered additional.
Okay, now it's about the tummy tuck. The differences between the tummy tuck and the mini tummy tuck.
Right. So a mini tummy tuck, it's mini because you're doing less, but it's not necessarily mini because the incision is so much shorter, okay? So a mini tummy tuck incision is still longer than your typical C-section scar, okay? But you're only addressing the loose skin between the belly button and that suprapubic area. So you're basically just stretching that down, removing the excess skin. You're not transposing the belly button and you're not doing application, right? So very, very few people actually qualify for a mini tummy tuck. Those are people that have strong abdominal wall, they don't have any separation, okay? And all they need is to kind of just tighten up that little pooch of skin between the belly button and the suprapubic area. However, most people are gonna need your full tummy tuck. So a full tummy tuck is when you extend it a little bit further out to the hips, and you're going to have the umbilical transposition, and you're going to have that muscle repair.
Will lipo help with lipohypertrophy?
With lipo help with?
Lipohypertrophy.
Oh, lipohypertrophy. Or, well, the only hypertrophy that I've heard is a paradoxical hypertrophy that can happen from cool sculpting. I'm not sure if that's what the question is referring to, but sometimes when you do, I personally don't like cool sculpt. I don't think it works well. And one of the complications of cool sculpt is that instead of actually shrinking your fat, the fat grows. Okay, it's called paradoxical lipohypertrophy. Okay, and so if you develop that, then if you go back and just do your regular liposuction, yes, we can take care of that and we can reduce that once again.
And the last one, it's about the boots, circulate. Can you wear them when you go to sleep?
Oh, that's what they're for. Yes, definitely. Please do. So what is the Circulate? The Circulate is what's called a sequential compression device. It goes around the calf and it keeps the circulation in the legs moving to minimize the risk of blood clots. Okay? So the whole point of them is to wear them, especially when you're not being active. So you definitely want to wear them when you're sleeping. You definitely want to wear them for all travel. Okay, so you're going to be a long time in the car, or if you're going to go on the plane, you want to have those on and working. Or just whenever you're not being very active, you're just kind of watching a movie or something like that, okay? The only time you really don't need to wear them is when you're actually physically walking and moving around. So please, please, please use your Circulate device while sleeping.
And the last question is very important.
Right.
How can we book an appointment with you?
Yes. So you definitely want to go to our website. The easiest way to do it is go to our website, okay? And so that's www.puroplasticsurgery.com. And there you're going to find a button that says virtual consultation. Hit that button, okay? And it's going to ask you for your information and some photos, okay? That goes directly to us, and then I can go over all your information. I can go over your photos and have our coordinators reach out to you. So that's the best and easiest way to do it. And if you have trouble with that at all, then just send us a DM through IG and we'll help you through there as well. Okay? All right, everybody. Well, that was pretty cool. I hope you guys understood all that information. A lot of big changes here in Florida. How permanent are they? I don't know. We'll see. We'll find out. But of course, if anything changes, I'll let all you guys know. All right? But in the meantime, I would love to see all of you next week on Hump Day with Dr. Alex Earl. I'll check you guys then. Ciao.
Yeah.
Yeah.